everyone. So, we welcome to the Psych Space presents Let's Talk Mental Health on the topic understanding child development. So, as we know that child development it refers to the sequence or the sequential part of changes that happens physically, emotionally, or changes in a language that occurs in a child from birth to the beginning of adulthood. So, in this process, a child progresses from the progresses from the dependency on their parents to becoming independent. So as we know that wholly it is influenced by genetic factors and the events during the prenatal life. So with that, it is very very important to understand child development, because when we observe and monitor child development, because to ensure that the children meet the basic developmental milestone. So as we know that checking the child's developmental progress at a particular age, it marks a guideline of an ideal development. So for the today's session, we'll be discussing about the age group of 0 to 3 years, and we have our two speakers, which is Ms. Gargi Chakraborty and Ms. Priyanka Bhattacharjee. So let me introduce both of them as well. So, Ms. Gargi Chakraborty is a clinical psychologist and psychotherapist associated with multiple organizations pan India. Over the years, she has been working in different areas of mental health and was also active on mental health awareness creation in different media platforms, including Doordarshan and All India Radio. She has been associated with National Institute of Mental Health and Neurosciences, NIMHANS, Senior Research Fellow. Currently, she is running her mental health initiative in Bangalore. And coming to Ms. Priyanka Bhattacharjee, she is also a clinical psychologist and the founder of Psych Space as well. So, not delaying much. So, there's some of the important question that we want to discuss about. So, what? So basically,
And it's okay,
so
Lisa,
as
go ahead. I think that's a good sign of this beginning. It's a
yes,
beautiful beginning, right? Please go ahead.
yes. So, as we know, the developmental milestones, right? So, what are the developmental milestones that we can see during the stage, like stage of 0 to 3 years?
Um, Priyanka,
You
you
can
would
you
start?
can go ahead, Gargi. Yeah, you can go ahead.
Uh,
Then I'll join. Yeah.
First of all, thank you, Lisa. Thank you for having me over here. And this is such a relevant topic that we need to talk about, this childhood development and the milestones, as you asked, like what we can see as milestone. To begin with, first of all, we need to, like for our viewers, we need to understand what these milestones are. When we talk about childhood milestones, these are like when a child is born, like right from the moment they are born, the child starts developing, right? So the observable developments that has to be there in each and every age, at each and every point of time, like for example 0 to 3 months, what we can expect, what we should expect a child to develop properly, because if these observable characteristics do not develop at this point of time, at the certain age when it should develop, that can impact a lot in the child's life when the child will grow up and become an adult. So having said that, every so this every genre, like every domain, there are multiple domains actually of milestones if we see. So there can be physical development domain, there is like social development, communication development, cognitive development, multiple domains are there. And in that, these milestones, like in general, definitely we can expect the overall understanding. Who doesn't have? Everyone get have a baby, and they understand and expect that these are the signs that we can see in a child. And parents often get very much worried also if they do not get to see what they expect. Ideal mindset needs to be there. That's the reason these kind of discussions are very important, that people need to know how much flexible they can be, how much they need to expect, how much what role they can play, or how a child is expressing those milestones slowly and gradually. and how to motivate the child, or maybe how to maintain the proper environment around the child. These all these things are important. So physical development is a very crucial thing, but overall when the child is just born, the basic things like the child is communicating, starting to communicate with the environment with certain reflex actions. So those are like very very crucial milestone. Like a child is showing rooting reflexes, sucking reflexes. Every child does show that, but sometimes a child can also choose not to show it. And when I'm saying choose not to show it, means it is definitely something very much important to observe what the child is expressing and what the child is not expressing. So initially the child interacts with the environment through such reflexes. Then the child can start responding slowly through cooing, or maybe the child can start identifying the faces of the common people around them, the mother, the significant others around the child. The child expresses through smiles. This is a very like people around the child get so excited when the child shows that muscle movement in the face. But that is also a significant milestone. A child starts expressing slowly and gradually. If we start moving, like the child doesn't only express, child starts identifying those things on the others. Like when the child is when somebody is smiling in front of the child is noticing that. Like noticing all the facial expressions are also important. The child starts understanding the sign of no. Like if the child is reaching out to something which he or she is not supposed to reach out, and the instructor or the parent or the caregiver who is present is signaling no, the child is understanding and picking up this response is also a significant understanding milestone. So similarly there are many such understanding, focusing on the um, familiar figure, identifying the familiar figure among others. This is one thing. Then there this a very significant milestone is understanding of object permanence. Like object permanence is a concept. Like objects continue to exist, but children, chota sa, like infants, chotu baby, they don't understand, they don't know like the object will continue to exist or not. But slowly when they are moving ahead from 0 to 3 months, then 3 months to 6 months, they're moving ahead, they're slowly moving ahead with this idea that no. And slowly this object permanence with a span of time slowly develops, and they start understanding no, the object continues to exist. These are the things. And then there is development of eyesight, then there is development of joint attention. Slowly they start with the other parallel development. I'm talking about the cognitive development mainly the brain, how is it developing, and the child, how the child is starting to communicate. But there are vast other areas. I think Priyanka can reflect on that.
Right. Thank you, Gargi, to take up this topic, and thank you so much for giving your time to us in discussing this something very significant in today's time. Particularly when it comes to child development, and yes, there has been good amount of awareness, but also somewhere we see that there's a massive change in the family structures, in how parents are interacting with the child, because there's a
Mhm.
huge change in the lifestyles of the people, because this is a very new age. This is the age of technology, where the parents have to deal with the technological interference in the parenting as well. At the same time, they are engaged, both the parents are engaged in their respective work, employment. So in the midst of a lot of things, this child development has to happen. Although child development is not something very new, but then why it's coming so much into the forefront, because we see a lot of issues with the developmental milestones. When we talk about issues, as in there is much delay in the developmental milestones, as Gage has mentioned that there are different domains and aspects of the child development, but there could be some time when we do not see them happening at the right time and the right age. And that is when people, they find it difficult and they come and report to us. And when this happens, that is when we have to really talk more about that, how can we identify these, how can we remain more vigilant and be aware of. So I think Gagi has mentioned rightly about the various, collectively about the various social communication, the aspects of eye contact, other aspects of socialization. But yes, I would like to say that 0 to 3 years of age is a very crucial, early developmental stage, which sets a major milestone for all the life to come in the future for that particular child to grow up as an individual. So starting from their, physical, what do you call the physical developments, like the motor developments, starting from the straightening of, head holding, able to sit properly, able to, hold themselves well. By at least 4 to 6 months, we see, not 6 months, but at least by 3 to 4 months, we see the child should be able to, hold themselves on their tummy, like, upside down, when the babies are put on their tummies. So the head holding and every all these, small little things, they also have a very very strong connection to the child's, intellectual functioning as the child is growing up. Because our intellectual functioning is nothing but a combination of two things. Number one, something which the child is born with, it's innate, right? And then comes how the child is interacting with the environment. And when we talk about this interacting with the environment, we are talking about what kind of exposure, or in technical language, what kind of stimulation the child is being getting while the child is developing. And that marks when we see a child, and when we assess on the child's developmental milestones, they seem to have not seem they have a very close correlation with their developing intellectual functioning. And that's a reason why we have to, assess these aspects so well. So there have been, I wanted to present a PPT where I could show certain charts where we can see, some milestones, so that it gets more visual, like for our viewers. But since there's some issue with this sharing, but maybe we can definitely release the posters later on in our. Over our social media platform. But certain things I would like to mention that, for example, what do we see in terms of the social, cognitive, language, and the physical developments in this particular age. And mostly, Gagi has, covered a few. I'll just cover a few which has not been covered so far. uh, Basically, in terms of language, the issue, I'll just speak in terms of, how it has a very close connection to the kind of cases that we see. That often we see nowadays, particularly post pandemic, we see, children coming with a lot of autistic symptoms or autistic like symptoms. That is majorly has also because of the excessive screen viewing time that has happened during the COVID time, or post pandemic, or because of this lockdown situation where the child was, had very limited social interactive options, and they were mostly interacting with the gadgets, so they had very limited interactions in the home front as well. The child was not mainly, meeting a lot of other children, meeting any other people. They are not seeing some new faces. So, in this particular age, it's important that the child is making cooing sounds, right? That vocalization at this particular age is very important. Yes, it does. It has a very close connection to the muscular development over the oral structure. At the same time, it marks a very important milestone in terms of the communication, in terms of socialization as well. Apart from that, there are certain things like, whenever there's a sound, the child is turning his or her head towards the sound. So locating the sound is very important. Okay, it really marks a very important milestone during this particular age when it comes to language and communication. So apart from that, we also see that, the child is able to imitate some, sounds or some words, like, very very basic to their mother tongue, like tata, bye bye, some, so what, however they are termed in their own mother language, or waves, gestures like waving and things like that. So imitation in this particular age is extremely strong. And as we know, that child, they learn more by seeing things. So observational learning during this particular age is at peak. although the entire childhood and as the child is growing, of course, with all human beings, I mean, observational learning has been something very strong. But with children at this particular age, they imitate a lot. So since they imitate a lot, they can imitate a little bit of sounds, they can imitate gestures. So it's very important to environment. Second, sorry, there was a call. Yeah, so it's very important to give that particular environment to the child where the child makes, significant imitation and is able to reproduce. Okay, it might happen that that reproduction could be a trial and error method. Okay, but the child will again keep learning as the child is making more of such trial and error methods. All right, so yes, during this particular 0 to 3 years of age, we also see changes, we also see very significant development in terms of, fine motor skills, like, holding up a pencil, to a lot of things, scribbling, understanding instructions, trying to or able to copy the copy the structures and things like that. So we see a lot of significant changes. Okay, then also something to do with chewing, right? So chewing is also very important at this particular age. They're able to hold a particular, hold a glass or a cup, and able to, hold a glass of water or a glass of milk. It's important for them, because it's not that the idea is not to make them self-reliant at this age, but it's important to give them that stimulation and exercise so that the child is able to have the muscular growth and the cognitive growth at this particular period. Okay, and from that perspective, it's very, very important to keep these milestones in mind. And since I could not really present this here, so maybe, we can really upload this particular chart in the coming time over our social media handles for all our viewers. That would be easier.
So, ma'am, with this conversation, I would like to know that are there any warning signs for the parents that they need to be vigilant about?
Yes. Yes, of course, there are a lot of warning signs as we are discussing these milestones. This is very, very important to also notice that, okay, when ideally, if these milestones are not happening, or if there are anything that we are observing, any excessive behavior or any behavior that is getting inhibited, or the behavior that has developed is getting lost slowly. If these kind of things are happening, these are mostly broader warning signs. Like there can be multiple areas of warning signs, like for example, as Priyanka was mentioning about physical development, language development, multiple skills are developing in a child. But suppose we suddenly get to see that these whatever has developed is the child is not showing or responding the same way. This is one very significant problem that actually occurs in children, or the way the child is supposed to react or respond, the child is being numb or being rigid or being or showing repetitive pattern of behavior, one skill lost, or one skill just not uh, appearing the way it should appear. The child is not expressing, the child is not uh, giving eye contact, not responding when the name is being called, not responding when people, familiar faces, or on whose call the child used to respond is not responding, suppose. Physical development wise, motor development wise, also there are multiple significant things that needs to be observed in this crucial age of 0 to 3 years. And cognitive development wise, there are many things. For example, the child has started responding by onto certain calling or certain way the child is responding, or when the child is asked to point something, the child used to point, but now the child is not pointing. By the age of 3, the child is not pointing anymore. It's high time that we get alert there. And we cannot let the child continue with what they are doing. If we are understanding, suppose the child is not speaking by 3 years of age, it's a very very alarming sign. It is important for parents to understand that we cannot take it casually, saying that okay, it is okay, the child has not is not speaking, many other family members also spoke later. Many a times clients come to us and say that many other family members, इनके पापा भी थोड़ा देरी से ही बात किए थे, इनके दादाजी ने बोला कि बाकी फैमिली मेंबर भी थोड़ा देरी से बात किए थे. With due respect to everyone, please understand that अगर बच्चा 3 साल की उम्र तक, आज की टेक्नोलॉजिकली एडवांस्ड कि एडवांस जमाने में भी बच्चा अगर 3 साल की उम्र तक बात नहीं कर रहा है, या जो बात करता था वो नहीं बोल रहा है, या रेस्पॉन्ड नहीं कर रहा है, गुस्सा के टाइम पे गुस्सा आना, या जब स्टिम्युलस इज लाइक अबाउट स्माइलिंग, द चाइल्ड इज नॉट स्माइलिंग और रेस्पॉन्डिंग द वे द चाइल्ड शुड रेस्पॉन्ड, देन इट इज अ कंसर्न. और इंटरेक्शन कर नहीं रहा है बच्चों के साथ, वो एंजॉय कर रहा है पर दूर से, या फिर अनयूजुअल प्ले कर रहा है, या कोई रिपीटेटिव बिहेवियर शो कर रहा है, या कुछ सिंपल स्टिमुलस में अचानक से एजिटेटेड हो जा रहा है. If these are the things, if this is happening, then this is very very important to understand that this are really really alarming signs. Consult with an expert at that point of time, because it comes with a lot of burden also in mind that okay, should my child is developing in a normal way. And a request is, instead of getting tensed or anxious or jumping into a conclusion that definitely my child is having a problem, many a times it happens that for some reason, if there is a difficult environment, the child is in going through something like the child is observing difficulty in the environment. But it can be any kind of difficulty. The child sometimes withdraws their behavior, and as Priyanka rightly said that this constant exposure in this pandemic and post-pandemic times, we have seen the children got too much of exposure of the screen time, and that led to a lot of complicated behavior pattern. Like the child is as if like sitting inside a box, the child is not reciprocating or not imitating properly, or if the child is imitating, then over imitating, or if the like kind of behaving in a robotic manner, the way whatever the child is observing, the child is exactly like going to repeating that. Maybe too much of parrot like speaking is happening, or many things like these things can happen. And another significant warning sign is if the teeth development, like by a certain age, like maximum by 10 to 11 months, teeth should come out. If that is not happening, it is a warning sign. It definitely professionals need to be consulted, and do not wait that okay, the child is enjoying, we are enjoying, the child only likes soft food and they do not want anything else. Remember one thing, children do not have that decision making capacity developed at that point of time. It's not about their choice, they do not want or they do not like, doesn't really depend on that. They don't have the sense of right and wrong at that point of time. So if the child is not developing something, consult with a pediatrician, consult with a mental health professional, what is happening, get clarity, then maybe accordingly steps can be taken. Over to you, Priyanka.
Yes. I think you have really covered all that thing that is, that I can really think of right now that we see mostly in the clinical setup. But yes, one thing I would like to highlight here, of all the issues with developmental milestones, what happens, the something which is very challenging with, when it comes to behavioral science and, mental health, is the visibility. Right, a lot of things like object permanence, or those things, we do not see things. I mean, वो बहुत बहुत ज्यादा अच्छे से दिखता तो है नहीं, तो इसलिए बहुत ज्यादा
Right.
नजर में नहीं आता है ना. And
Right.
what is more tangible and what is more visible to people is the difficulty with the speech, right? और पेरेंट्स का ऐसा होता है कि अच्छा, मेरे बच्चे में कोई दिक्कत नहीं है, सिर्फ वो बोल नहीं रहा है. Now, this is a massive myth. Why? If the child is not speaking, तो speaking के साथ साथ बाकी जो developments होने चाहिए वो भी नहीं हो रहे. As the child has a delayed speech, the child is not communicating, the child is not speaking, child is not making any verbal communication. or some limited non-verbal communication, that means the child has also issues with all other related developmental milestones. और ये चीज
Absolutely.
हमें ये चीज हमारे पेरेंट्स को, ये चीज नए पेरेंट्स को या फिर पब्लिक इन जनरल को समझना बहुत जरूरी है, क्योंकि उनको लगता है कि बस बात करने से बस सब कुछ ठीक हो जाएगा, बट इट्स नॉट दैट सिंपल। तो आज इस सेशन के द्वारा मैं सबको ये बताना चाहूंगी कि इट्स जस्ट नॉट अबाउट द टॉकिंग, इट्स नॉट अबाउट जस्ट स्पीकिंग, बिकॉज इस पर्टिकुलर स्पीच के साथ साथ बहुत सारी ऐसी चीजें जुड़ी हुई हैं। आइडेंटिफिकेशन, आई कॉन्टैक्ट, एबिलिटी टू एक्सप्रेस, वो एक उस एज के हिसाब से जो भी वोकेबलरीज बच्चे को पता होना चाहिए उन सब चीजों के बारे में, द कंसेप्ट ऑफ व्हाटएवर द एज अप्रोप्रिएट प्लेस, ठीक है, एज अप्रोप्रिएटली। अभी जैसे कि 3 साल के बच्चे को या फिर 2.5 साल के बच्चे को, दे शुड हैव अ कंसेप्ट ऑफ अ कप, जो उनके साथ हमेशा मतलब इट्स रिलेटेड टू देयर डे टू डे फंक्शनिंग, कि वो कप में मान लीजिए कि दूध पी रहा हो, ग्लास में दूध पी रहा हो, या ग्लास में पानी पी रहा हो, प्लेट्स, चम्मच, जो ये बहुत ही बेसिक चीजें होती है, इन सब चीजों का भी कंसेप्ट फॉर्मेशन बहुत इंपॉर्टेंट होता है। तो ये सारी चीजें जो है स्पीच के साथ साथ, ये सारी आइडेंटिफिकेशन, कंसेप्ट फॉर्मेशन, recognition, सारी चीजें जुड़ी हुई है। So it cannot be seen in isolation. That's all I wanted to say.
There is one DM question, so I would like to take up that one.
Mhm.
So, the DM question, it is mentioned that my child is 3 years old and has not started speaking. Will sending him to school help?
Gagi, you want to go first?
One very simple answer to this thing would be no. If your child is not speaking yet and by the age of 3, no, schooling is not the treatment that your child need. Schooling definitely has its own benefits. I mean, schooling is schooling; it's separate thing altogether. But to make the child speak, you first, if it is definitely an alarming thing, if your child is still not speaking at all, please go consult an expert and see and get the child checked for what reason the child is not speaking, what is happening, get the child assessed, and ideally, speech therapy needs to be done. That's the best thing that can be done. And of course, and this generation, this age, children definitely needs to go to school, but putting the child in a situation, because common advices usually come that way. I think Priyanka, you would also agree that school में भेज दीजिए बच्चे को and सब ठीक हो जाएगा, interact करने लगेगा. It is just putting pressure on the child because you do not have any idea what actually is provoking the child to not to speak. Is it an organic problem or psychological problem or just something else? Like what is exactly happening with the child? Why the child is not speaking? You do not know. So thinking that it might put pressure on the child that if other children at that age is speaking around him or her and he's not being able to, that might create other problem in the child. So first maybe that problem can be sorted.
Absolutely. The most dangerous part here, Gagi, is I have seen a lot of, with due regard to all the medical professionals, I have really heard this particular statement coming, or this kind of a suggestion coming from a lot of doctors, that school bhej dijiye, theek ho jayega. In fact, a lot of psychologists as well. So the deal here is because speech issues, first of all, we need to assess what it could be, right? Be it as Gagi has really mentioned and covered all the points, be it an organic cause or a psychological cause, it needs to be properly assessed and addressed. अगर किसी को ऐसा कुछ महसूस हो रहा है कि आपके बच्चे बात नहीं कर रहे हैं, स्कूल भेजना चाहते हैं आप, इट्स ओके, आई अंडरस्टैंड, तो एक बार आप नियरेस्ट मेंटल हेल्थ प्रोफेशनल या फिर पीडियाट्रिशियन को जाके इस चीज के बारे में थोड़ा बात कीजिए। एंड आई मीन, स्कूल जाना इज नॉट द ट्रीटमेंट, इट्स नॉट द सोल्यूशन कि वो जाते ही बात करना शुरू कर लेगा, right? It's most importantly needs to be addressed with the right approach. स्कूल साथ ही साथ जा सकता है, उसके लिए मैं मना नहीं कर रही हूँ, लेकिन स्कूल जाना इज नॉट द सोल्यूशन हियर। तो उसके लिए हमें प्रॉपरली एक अप्रोच में जाना पड़ेगा ताकि हम इस चीज को अच्छे से फाइंड आउट कर सके कि बच्चा किस रीजंस की वजह से नहीं बोल रहा है या बोल पा रहा है। सो दैट्स वेरी इंपॉर्टेंट।
Yes, ma'am. Truly, I truly agree with both of your answers. So, right now, I think we have to end this live session. We are at the end point of it. So, I would like to thank Gargi ma'am as well as Priyanka ma'am as well for all the interactions and regarding the topic. Truly, it's been a great time. And thank you, Gargi ma'am, for giving your time to us, for being in this live session as well. Thank you, ma'am.
Thank you,
Thank you
Lisa.
so much.
And one thing I would like to mention before concluding to all our viewers is, remember, we do not need to be hyper vigilant, but at the same time, we cannot be ignorant. We have to be mindfully observant enough to notice if there is anything missing on the child, if things are developing at right time. Nothing to get tensed or worried. These sessions are not to create tension that, okay, these many things can happen. Okay, let's get worried. No, it doesn't work that way. But early identification of the problem will actually help in early, solution, early recovery. So, and as Priyanka mentioned, that this important thing is milestones are the pillars and are kind of the stepping stones for the entire life. If this is not taken care of, then what else? So that
Right.
is very important.
Yes, absolutely right. Thank you, Gargi. I think that's a very beautiful note to wrap up today's session. Thank you so much, Gargi, for giving us this time, and thank you, Lisa, to so well and so nicely having this session done. Thanks to both of you from my side, and thanks to all our viewers. If there is any question, you can still DM to us on our social media handles, or you can just leave a comment on the below, and will definitely reach out to you. Thank you so much.
Thank you, Priyanka. Thank you, Lisa.
Thank you, ma'am.